Hey guys, Chris Williams, licensed clinical social worker, therapist here. Going to be talking about alexithymia, a $10 word there. So stay tuned and we will talk more about what that is. Hey guys, so alexithymia, not a word everybody is familiar with. What does it exactly mean? Well, the definition relates to the inability to feel or express emotions. So it's a really kind of clinical term that's used to describe people who just can't talk about or even really know how they feel. But there's sort of like a subclinical phenomenon that occurs with a lot of people. Um, you might see this a lot with people who have a history of using substances, even people who, have like video game addictions where they end up really just suppressing their emotions to the point where they just don't they're kind of numb to them. They don't have a language to describe how they feel. And so what they end up thinking is that they are in really control of their emotions, like I don't get really upset at things that I see other people getting upset by. I don't have these kind of extreme swings that I see some other people having, and they kind of like think that that means that they're in control of them, but really it's actually sort of a suppression of them, and so that's sort of like a form of alexithymia. We might also see this more frequently in men and boys because of the way in which oftentimes they're both socialized to kind of not express how they're feeling in the way that some girls would be and women. But also, some of it's kind of brain-based differences to a certain extent, just in terms of how men kind of think and deal with problems. So what we do see a lot of men having is like what you might call sort of cognitive empathy or action empathy, where you can really kind of get inside how somebody else might be thinking, or what that other person needs to or should do. But oftentimes in terms of how they might be feeling could be a little bit different. And when it comes to how I'm feeling, often we see like blanket statements. I'm stressed. I'm angry is a common one. So there's certain emotions that are more kind of promoted culturally, oftentimes, for men. Anger being one of them, that it's sort of socially acceptable for a guy to be angry, not so much for him to be depressed. So we often see men being able to describe anger, but not a whole lot more. And, we might see men more likely to talk about physical complaints. So, you've got neck pain, you're tired, lack of energy, rather than being able to describe emotions. So, this is an important thing to know about and to discuss and to distinguish for yourself, because it can end up causing us lots of problems if we're not able to, express how we're feeling. It doesn't mean that those emotions just aren't there. They're still there. They just have to come out in a different kind of way. And so they often can come out symptomatically, either in those physical symptoms or in things like anxiety or irritability, which, then impacts relationships, that kind of thing. I often will get guys coming into my practice who sort of say that they were, told to come there essentially, or encouraged to come there by, let's say, their wives. They don't really know why. They feel like their wives are expressing something to them about how they're not available enough, and they don't quite understand like what they mean by that. So this is kind of part of the picture, is that there's not a whole lot of an understanding of like kind of what's going on there. And so we'll want to talk more about how this kind of impacts people, and then also kind of what you can do about it, because once you identify it in yourself, then you can work to kind of change it or overcome it in some way. So we can get to that at a different day, but I wanted to kind of give you an overview, and if there's anything in here that you kind of identify with, feel free to comment, shoot me an email, give me a call, and we can kind of talk some more. Thanks for watching.